Everyone, my name is Jada Walker, and today I'll be presenting my career research project on physical therapy. I chose this field because I'm passionate about helping people recover, regain movement, and live a better quality of life. In this presentation, I'll talk about the educational requirements, license, graduate school, typical workday in an outpatient setting, professional organizations, and potential job opportunities. Educational requirements. To become a physical therapist in the U.S., students typically start with a bachelor's degree, most commonly in exercise science, which builds a strong science foundation and offer hands-on lab and research experience. After earning a bachelor's degree, students must attend a Doctor of Physical Therapy program, also called a DPT. These programs must be accredited by CAPTE, the Commission on Accreditation in Physical Therapy Education. DPT programs usually take 3 years and include both classroom learning and clinical experience. The main subjects include biology, anatomy and physiology, neuroscience, pathology, kinesiology, and more. About 77% of the program is classroom and lab work, and the other 23% is clinical education where students get real patient experience. On average, students spend around 22 weeks in their first clinical rotation. Certification and license. To officially work as a physical therapist, you must have a state license. First, you must graduate from a CAPTE accredited DPT program, and then you have to pass the National Physical Therapy Examination, also known as the NPTE. PTs also have the option to earn board certifications through the American Board of Physical Therapy Specialties. These include specialties like orthopedics, neurology, pediatrics, and more. Most states require license renewal every 1 to 2 years, and you must earn CEUs, continuing education units, to keep your license active. The number of CEUs varies by state, so it's important to check your state board individually. Graduate school is one of the most important steps in this career. As mentioned earlier, you must earn your Doctor of Physical Therapy degree, which usually takes 3 years after your bachelor's. During DPT school, students complete both classroom learning and clinical rotations, where they work directly with patients under supervision. To apply for PT school, many programs use a centralized system called APTA's application service. This allows students to submit one application to multiple schools. Schools also look for internship or volunteer experiences, especially in clinical settings like outpatient therapy, hospitals, or rehab centers. That kind of experience shows commitment and helps students prepare for graduate school expectations. Daily workday. For this section, I chose an outpatient physical therapy setting, which I have experience with through my personal internship. In the morning, the team and I will set up the treatment area, check equipment, prepare patient sheets, and review the schedule using electronic health records on laptops. Throughout the day, patients come in for evaluations, follow-up treatments, or progress checks. We greet patients, sign them in, and make sure all paperwork is complete. Physical therapists and PTAs work together to provide this treatment, like exercise programs, manual therapy, mobility training, and education for injury prevention. Communication is key in this environment between the PT and PTA, making sure they're on the same page when it comes to treatment plans with their patients. At the end of the day, all documentation is completed, equipment is cleaned, and everything is prepared for the next day. This setting teaches organization, communication, and patient centered care. Professional organizations. One major professional organization in this field is the American Physical Therapy Association, abbreviated as APTA. It was founded in 1921 and it supports physical therapist assistants, and students. APTA offers resources like continuing education courses, job networking, research updates, scholarship, advocacy for laws that protect PTs, and guidance for licensing. As a student, joining APTA can help you connect to the PT community and stay updated on career opportunities and graduate school requirements. For this slide, I looked at a real job listing for a home health physical therapist in Texas. The qualifications included graduation from an accredited PT program, a current Texas license, 2 years of experience, and ability to work independently and make professional decisions. What's very important for this job is the ability to work independently and to make those professional decisions. Because in this setting, with the home health PTs, you're usually going to be traveling to your patient's home and providing the therapy care there. This requires strong communication skills and clinical judgment since you may work alone without a full team like in a clinic. The salary can range, which shows that PT can be a rewarding career both professionally and financially. These are my AP7 citation sources, including the APTA.org program and the University of Houston Exercise Science program. Both of these sites help me gather accurate information about the educational pathways and professional expectations for a physical therapist. I highly suggest that if you're interested in physical therapy, to go to the APTA.org website to see all the information that they have. When it comes to PTs and PTAs, it's very knowledgeable and it is really a really helpful tool to use. Thank you so much for watching my presentation. Physical therapy is a career that combines science, compassion, and hands-on care to help people improve their mobility and quality of life. I hope this presentation gives you a clear understanding of the education, daily work, and opportunities within this field, and that you can take this information and go share with others. Thank you again for watching.